We're delighted to be joined, among others, by our distinguished chairwoman, Carolyn Maloney, who I understand does not have an opening statement, but we will call on you, Chairwoman Maloney, as the first questioner, if that's all right with you. Yep. I also want to thank my colleague, Jamie Raskin, for joining me and wearing a tie today. And behind me is a sun. That was produced by an artist named Rose Thurber, who was James Thurber's daughter. James Thurber being a famous American short story writer, very popularized in the New Yorker, among others. And it's the sun, and it's a cheerful sun. And I believe it's a great symbol of what ultimately we will face. The sun will come out and hopefully be as bright and cheerful as that sun by Rose Thurber. I want to thank Scott Dahl, the Inspector General of the Department of Labor, and his team, Elliot Lewis and Michael McCulka, for joining us today. The briefing continues a series of briefings held by our subcommittee to look at the important work of inspectors general in conducting oversight of the federal government's response to the pandemic. Inspectors general are more important to this nation than ever. Inspectors general are the gatekeepers and the guardians of taxpayer dollars and investments and ensure accountability in a democracy. Congress enacted the largest stimulus package. One sec. It's the trouble of having an antique clock. Congress enacted the largest stimulus package in American history. In fact, the largest single bill ever in American history in the midst of the pandemic, in which federal officials failed to take a meaningful leadership role. Inspectors general positions were statutorily designed by Congress to be outside of political interference and influence. Congress has the responsibility to ensure that independence and that IGs are able to conduct their work free from political partisan interference or threat of retaliation. Today, we're hosting the IG with oversight of unemployment insurance and worker safety standards, two incredibly important issues during this pandemic. As you know, the CARES Act included a massive expansion of unemployment compensation to include an additional $600 a week in federal pandemic unemployment compensation, a 13-week extension of benefits, expansion of benefits for the first time to the self-employed, gig workers, part-time workers, various waivers that allow states to get benefits in the hands of the unemployed as quickly as possible. Last month, the Department of Labor Office of Inspector General released its pandemic response oversight plan. The OIG's oversight will focus on various areas, including the administration of unemployment benefits and the enforcement of workplace standards that employers are legally required to follow. Inspector General Dahl has already issued an advisory report identifying concerns regarding the implementation of the unemployment provisions of the CARES Act. The report highlighted the Department of Labor's previous problems with managing stimulus funds during disasters and the implications for its coronavirus pandemic response, given the unprecedented amount of funds appropriated through the CARES Act. The Inspector General's work will also be critical to help expose improper payments and fraud schemes that might rob funding and resources from the people who obviously need it the most. Congress and the public will also look to the Inspector General to evaluate the OSHA efforts to protect people on the front lines of the pandemic, especially those with increased exposure risk. All of us have seen the stories about meat packing plants and the incredible levels of infection and the unsafe working conditions many of them were subjected to. Congress and the public will also look to the Inspector General to evaluate all of the aspects of the CARES Act that are relevant. While IGs do more than save taxpayer dollars, I think it's important to highlight that in the area of unemployment insurance fraud and improper payments last year, the Department of Labor's IG's office returned $33 for every $1 invested in its operations, which has really got to be one of the best in the federal government. So it's a worthwhile investment to have oversight. IGs fight for taxpayers and speak truth to power. We need to make sure they have the expertise and acumen and not blind political loyalty to do their jobs. I was proud to join with our Chairwoman Maloney, to introduce legislation to strengthen the independence of the IGs and to protect them from political retaliation. We certainly are going to fight to try to make sure Congress acts on that legislation as swiftly as possible, given recent actions. It's especially important to me that any legislation explicitly state that an IG can only be removed for good cause with documented evidence to support those good causes. Being comfortable with an IG or uncomfortable with an IG is not a criterion for removal. I'm also proud to sponsor bipartisan legislation to hold IGs more accountable themselves through increased transparency of the committee charged with investigating wrongdoing within the IG community, known as SIGI. And Mr. Dahl, who's joined us today, is just recently stepping down, I believe, as chairman of SIGI. And so we may want to query him about that as well. We protect IGs because they're the source of credibility and accountability. With these additional protections, we've got to ensure that federal IGs are purer than driven snow themselves. That's the source of their credibility and their standing. Ensuring the independence of inspectors general and their ability to work free from political interference and political retaliation is the best way to safeguard the trillions of taxpayer dollars that will be spent now and in the future in response to this crisis. So thank you so much, Mr. Dahl, for joining us. And before I call upon you for your testimony, let me now call on the distinguished ranking member, my friend, Jody Heiss from Georgia. Mr. Heiss.
Thank you very much, Mr. Chairman, and good morning to you and to everyone else. I wish we'd been able to see your clock. It sounded lovely, but it's good to see you. Listen, last week I co-signed a letter with several of my colleagues asking Chairwoman Maloney to bring us back to Washington to do these type of meetings in person, the way our founders envisioned this to happen. And we also ask, quite frankly, that we cease having these unsanctioned kinds of hearings. But unfortunately, I'll just tell you, the forum that we find ourselves in yet again today are not governed by any rules. I think we need to follow the rules that have been articulated by Rules Chairman McGovern. But we're not doing that, and we need to. And so with that, Mr. Chairman, I'll make a few remarks, and then I plan to sign off. But Inspector General Dahl, I want to thank you for being with us today. We appreciate that very much. We all know the reality is that federal government, along with state governments, have asked a lot of the American people to stay at home during this pandemic, the crisis, and we have all watched, of course, many Americans have lost their lives through this, but we also know at the same time, many have lost their livelihoods. Some of them temporarily, but many permanently have lost their livelihoods during this time, and as a result, we're seeing across our country a tremendous rise in anxiety, anger, confusion, and these types of things as a result of unprecedented actions and requests coming to the American people from their, be it local, state, or federal governments. And so what we need to do is fully reopen America as safely and as quickly as possible. We have many people suffering, obviously, some degrees of mental stress, at least from being told to stay at home. And of course, many others have not moved forward with some medical treatments that they need because of fear of getting out in public. And so we need to address these things. Part of the package that Congress has put forth, obviously, is to expand the capacity and the ability for individuals to get unemployment benefits. I think that's appropriate at times like this, a degree of a safety social net, if you will, and I don't know of any better time for that type of thing to happen than in a scenario like this. But look, the American people love to work and they want to work. We are a working people. From the very beginning of this nation, people forging across the wilderness and the prairies and building skyscrapers and building railroads. And today, we all know hundreds of people working 2 and 3 jobs to better their own lives, to better the lives of their families. American people love to work. They love to improve themselves. They love to improve their own skills by training, by education, by just sheer determination. Americans love to work, and we've asked them not to. Unfortunately, at the same time, when you have an emergency situation, there are many people who try to take advantage of the system. And unfortunately, we have now some who are trying to take advantage of the system of unemployment when they are not eligible, frankly, to receive that. And that poses not only a waste of money of our government, but also of our fellow taxpayers. And so the funds that we're talking about here must go to those individuals that are eligible to receive it. These funds need to go where they are intended to go. And even in any situation like this, any emergency, particularly something as enormous as the CARES Act, obviously, we need to do our role of oversight of those things. And so I applaud your work, Mr. Inspector General, in obviously something that we must and we need to have oversight of and look into. But it's not in the nature of the American people not to work. I just come back to this. It's critical that we reopen the economy and do so as quickly and as safely as possible. The sooner we do that, the better. And again, I appreciate you being here. And with that, Mr. Chairman, I'll yield back. Thank you very much.
I thank the ranking member. I will point out that the House did adopt a rule allowing virtual hearings by committees and has exhorted committees, in fact, to undertake to do just that. There's certainly nothing to prevent a committee such as ours from having briefings such as this. I will also point out that while it may be in the nature of Americans to want to work, it's also in the nature of Americans not to want to be sick and die. 2/3 of all Americans, according to the recent poll, believe we're reopening too fast. They are concerned about the health and safety and welfare of themselves and their families and their communities. And so I agree with the distinguished ranking member that we have to do this safely. We obviously want everybody to get back to work and like to return to normal, but not at the expense of people's lives. And so we need to proceed accordingly. As I mentioned, our guest today is Scott Dahl, the Inspector General of the Department of Labor, and he is joined by Elliot Lewis, who is the Assistant Inspector General for Audit, and by Michael McCulka, who is Special Agent in Charge, New York Regional Office. And with that, Mr. Dahl, you've got 5 minutes or so to tell us what you think we need to know.
Thank you, Mr. Chairman. Good afternoon. More than 40 million unemployment claims were filed over the last few months, and tens of millions of people are struggling through this pandemic without the economic security and health coverage of full employment. This is why the Department of Labor must exercise strong oversight of the Unemployment Insurance, or UI, program, along with delivering on other vital DOL programs. UI is a joint federal-state program that provides benefits to those who have lost their jobs. DOL directs and oversees this nationwide system, and individual states administer it. The OIG provides independent oversight through audits to strengthen the program and criminal investigations to combat large-scale fraud. Over the past 10 years, our UI work has resulted in more than $3.7 billion in monetary accomplishments. As the chairman pointed out, this is an estimated return of $32 for every dollar taxpayers invested in the OIG. Let me quickly highlight several concerns about challenges that the department and states are facing relating to the UI program. First, as a result of the unprecedented increase in unemployment claims, states are struggling to pay claimants as quickly as possible, at the same time ensuring that benefits are paid properly. We reminded DOL of previously identified program weaknesses, including inadequate staffing and outdated IT systems. Though the states and the department have taken steps to improve these areas, we remain concerned about the effectiveness of their efforts. Second, the enormous expansion of UI benefits by more than $260 billion under the CARES Act also substantially increases fraud risk, with criminals easily exploiting system vulnerabilities. For example, we are currently investigating the alleged theft and fraudulent use of over 36 healthcare workers' identities that were stolen while they were combating COVID-19. Fraudsters allegedly used these victims' identities to file fraudulent unemployment claims in multiple states. This is just one example of more than 300 investigated matters involving UI fraud we are aggressively pursuing. The department has estimated that about 10% of UI payments are improper under the best of times, and we are in the worst of times. That means that at least $26 billion will be wasted, and a large portion of that will be pocketed by fraudsters instead of going to legitimate workers. To help DOL and states address these challenges, we recently issued several important reports and alerts. Last week, we issued an alert about self-certifications for pandemic unemployment assistance authorized by the CARES Act. This assistance is for self-employed, gig workers, and others not covered under the regular UI programs. We alerted the department that states' reliance solely on self-certification to determine eligibility significantly increases the risk of fraud. And we have seen evidence of this in recent investigations. DOL should seek clarification from Congress or request legislative action to curtail this fraud. The OIG also issued a fraud alert about scammers taking advantage of people applying for benefits by falsely offering to help them file claims only to misuse their personal and financial information in stealing these payments. We sent this alert to state workforce agencies and DOJ to warn the public not to fall prey to such scams. We are coordinating with the National Center for Disaster Fraud, U.S. attorneys' offices, state workforce agencies, and our law enforcement partners on pandemic-related fraud. And we just conducted UI fraud training to more than 300 of these partners nationwide. Further, as a member of the Pandemic Response Accountability Committee, we are working with other OIGs to detect and prevent fraud and mismanagement of the trillions of funds provided by the CARES Act and other legislation. In addition, we are reviewing the pandemic response efforts of other DOL agencies, including OSHA's actions to protect healthcare workers on the front lines of this pandemic, and OSHA's guidance to help employers prevent COVID infections in the workplace. We appreciate the subcommittee's support of our independent oversight work. Thank you for the opportunity to provide this briefing.
Thank you, Mr. Dahl, and right on the nose. Wow, you're a pro. Thank you. It now gives me great pleasure to recognize the distinguished chairwoman of the full Committee of Oversight and Reform, Chairwoman Carolyn Maloney.
For hosting this important briefing. I thank all of my colleagues and particularly IG Scott Dahl for being with us today. I've enjoyed working closely with him, with you, Chairman Connolly, to introduce legislation to help ensure the independence of our country's inspector generals. And as the coronavirus pandemic continues to endanger the health and safety of the American people and the need for oversight of federal programs becomes greater than ever, President Trump has undermined IGs who provide critical oversight of federal agencies. In the past 2 months, President Trump has removed, replaced, or attacked 5 inspectors generals at the Department of Defense, Department of Health and Human Services, Department of State, Department of Transportation, and the intelligence community. The president has made clear that he will target any IG he feels are not loyal to him. The obvious result is that our IGs fear that the president will fire them just for doing their job. Mr. Dahl, the Inspector General Act does not require IGs to swear an oath of loyalty to the president or any president, correct? Yes or no?
No,
Okay, in fact, IGs are statutorily required to follow standards that require independence. Isn't that right?
yes.
How do you ensure that your office meets the rigorous auditing and investigating standards?
We have protocols and standards that are in the community and that we've developed, and we follow those assiduously to protect the work that we're doing and to preserve our credibility.
On May 26, your office issued an alert memo noting your concern that the Pandemic Unemployment Assistance Program created by the CARES Act lacked sufficient safeguards to detect and prevent improper payments and fraud. You recommended that states implement measures to maintain the integrity of the Pandemic Unemployment Assistance Program, such as requiring claimants to document earnings. How did the Department of Labor's Employment and Training Administration respond to your alert memo?
They responded that they had a different interpretation of what's permitted under the CARES Act in terms of imposing requirements for documentation, and they elected to go the route of the other recommendations that we made in terms of seeking clarification from Congress or a legislative fix to allow that guidance to go out.
Well, so instead, the department issued guidance specifically informing states that claimants need not submit earnings documentation. Isn't that right?
That's correct.
And without such documentation, how would you describe the risk for waste, fraud, and abuse regarding the Pandemic Unemployment Assistance Program?
We see the risk as being significant, and in fact, we're seeing evidence of this in our investigations.
Well, sitting here today, what would you like Congress to know about the work of the IG community during the coronavirus crisis?
Well, I think we're all of us, all of the OIGs are working nonstop at ensuring that the CARES Act and the other legislation is implemented as quickly and as with as great of integrity as possible. And I think we're working tirelessly to make sure that the American workforce is protected and that they're getting their payments promptly and it's going to the right people.
Well, I want to thank you today for your testimony, and let me close by reiterating that Congress must protect the independence of our IGs to make sure they can do their jobs without fear of retaliation. I look forward to continuing to work with Chairman Connolly on the bill we introduced with Majority Leader Hoyer and Representatives Lynch and Raskin to prevent the removal of IGs without legitimate cause and documentation. And I hope my Republican colleagues will join us in that effort, and I yield back to my distinguished Chairman Connolly.
Thank you, Chairwoman Maloney, and I'm proud to join with you as well. We have to protect the independence of our AGs. Elisa, over to you.
Thank you, Chairman. Next, we are now going to open up questions for Mr. Sarbanes. Mr. Sarbanes, you are now unmuted.
Thanks very much, Mr. Dahl. Can you hear me?
I can, yes, thank you.
Great. Thanks for joining us today, and thank you, Chairman Connolly, for convening this and for your work on oversight independence, which is critical with the inspectors general. Mr. Dahl, as you'll probably hear if you talk to any member of the Maryland delegation, and I'm sure members of Congress across the country, the pressure that's been put on the state unemployment compensation apparatus, the infrastructure of that is pretty extreme under these circumstances. We certainly understand why that is, because there's billions of dollars being pushed out the door. It's part of the relief package that we think is so critical, but these systems generally aren't built to handle that kind of traffic. So there have been a lot of problems. We've seen that in Maryland. And one of the things we're trying to sort out is where are those breakdowns? Why are they happening? What can be done to address them? I'm curious to understand, as you look at the Department of Labor and this pipeline of funds that starts at the federal level and then makes its way out to the state systems, how far does your oversight extend? In other words, if you want to think about it like sort of pipes in a system, there are big pipes on the front end where the federal money is taking the dollars out, but then you partner at the state level. How much will you be able to tell us about where the problems are at that connection point between the federal system and the state system? And maybe you could talk a little bit about the Interstate Connection Network, the ICON database, what that is, and what that reflects about the experience that states are having in terms of trying to implement these unemployment insurance benefits.
Sure, thank you, Congressman Sarbanes. Our oversight extends the full length of the pipelines from the front end of the spigot, as you mentioned, to the federal government, where the funds go through, all the way to the end where the states are dispensing of those funds. But we do, as you said, have to partner with the states because of our limited resources in identifying where the problems are. And ICON and that network is a potential data base rich with important data that we can use our data analytics work that we are doing right now with the states to help them to detect these fraudulent schemes early on and to identify other problems that are occurring in those states. And many of our investigations involve multiple states. And so there's the importance of getting this data, the data sets from the individual states so that we can match them up and see if somebody is, as we're finding, is a common fraud scheme. They're defrauding multiple states using these stolen identities. I think the
let me just cut in for a moment because I've got about a minute and a half left. So certainly, with respect to any fraudulent activity, I appreciate that you would want to extend your view all the way to the end point in terms of what's happening at the states. But in terms of the way the unemployment insurance is being administered, there's obviously administration that happens at the federal level, but there's administration at the state level. Are you able, through the lens you bring, to give us a kind of report out on how different states are handling their responsibilities in terms of administering the program and paying claims? Are you getting that data back in some kind of way that could help us understand those challenges, but also sort of show comparatively from one state to the next how well they're doing in the processing of the claims that are coming in?
Yes, we're doing that through both the lenses of our work and also through looking at what DOL is doing in their oversight of how the states are administering the program. And we did this back with the Recovery Act, and we're doing it again now, and doing some of those state by state comparisons, as is DOL.
Okay, well, my time's up, but I would could we reach out to your office to get some perspective on, in my case, how things are going in Maryland, at least from your vantage point?
Absolutely, happy to. We'll connect with your office.
Thanks very much. I yield back.
Thank you, Mr. Sarbanes. We will now go to Mr. Raskin. Mr. Raskin, you are now unmuted.
Great. Can you hear me now?
Yes.
Can you hear me?
Yes.
Okay, good. Mr. Dahl, thank you so much for your testimony. OSHA, of course, is the lead agency charged with protecting worker safety in the workplace in our country. But it has been essentially AWOL during the COVID-19 pandemic crisis. It has refused to issue emergency standards that would protect workers, both workers on the front lines, but just workers in the workplace generally, because everybody needs to be pursuing social distancing and mask strategies. So we passed the HEROES Act in May to compel the issuance of emergency safety standards for workers. But of course, the Senate has not acted on the HEROES Act yet. So basically, America's workers are waiting for these rules to come out to protect them. And we've seen, on the contrary, the administration and the president forcing with employers meat packing workers back into the plants without the proper procedures, without the proper equipment, without the proper rules internally. I wonder if you could comment on OSHA's conduct so far in protecting America's workforce.
Thank you, Congressman Raskin. We are actually evaluating OSHA's guidance that they've issued and their activity in terms of their efforts in protecting employees as they return to work. And if I could quickly just turn to Elliot Lewis to ask him to address your question specifically.
Okay, and if Elliot could also explain to people the difference between a voluntary guidance and actual regulations and rules.
Okay, hi, this is Elliot Lewis. And yes, as the Inspector General said, we're currently assessing the guidance that the department has issued. Obviously, if it's voluntary guidance, it's just that, it's voluntary. We will be, once we do this initial assessment of the guidance they've issued, we will be doing work on the ground to see what kind of inspection activity and enforcement activity the agencies do. Specifically, I would note in terms of the meat packing, the meat processing plants that I believe was mentioned, we are coordinating with Department of Agriculture, IG, on that specific topic. So we do want to we will be looking at in these projects that we're conducting, what kind of challenges are occurring in the different businesses, such as meat packing, and we'll be looking at, regardless of the guidance or requirements that OSHA has issued, what's occurring on the ground, and where did that fall short, or where did it protect the workers?
Mr. Lewis, one way that we determine what's going on the ground is we look at complaints, and apparently there have been thousands of complaints filed with OSHA. Are you aware of a single citation that's been rendered against a meatpacking plant or any employer because of failure to abide by reasonable safety standards respecting COVID-19?
Yeah, my understanding at this point is one citation's been issued, but it does take months at times for citations to be finalized with OSHA.
So you're saying in the entire country, over the course of the last 4 months, there's been one citation?
That I'm aware of at this point.
Okay. Are you doing a separate review with respect to frontline workers, the doctors and nurses and bus drivers and grocery store clerks?
I expect we'll be doing different types of reviews like that. The current review is just all encompassing, looking at guidance that has gone out. And from that, we will determine where to focus.
When can we expect your report? We're very eager to see it.
The initial report, we're looking at the end of this month.
Okay, and so that would be both comprehensive about all workplaces across the country as well as frontline workers. Is that one?
Yes, that would be, that'd be the assessment of the guidance.
Assessment of the guidance. Okay. Mr. Chairman, I don't know if I've got any time left. I'm not seeing the timer. Do I have time for one more question?
You do. Go ahead.
Thank you. If I could just go back to Mr. Dahl then. As the chair of the committee pointed out, there's been this series of firings of the IGs on April 3rd. The president sacked Atkinson as the IG of the Intel Committee. April 6th, sacked Glenn Fine as the IG for Department of Defense. Attacked Ms. Grimm, who we've spoken to at HHS on April 7th. May 15th, the president announced his intention to sack Steve Linick, the State Department IG. First of all, is this unprecedented? And secondly, what kind of effect is this having on the morale of the inspectors general and their willingness to completely do their job in an unvarnished and robust way?
Well, Congressman, we always report the unvarnished truth, and no matter what the consequences, and we'll continue to do so. My office, we're working very hard, and we're much too busy to worry about these issues. We have pressing issues, the UI program, OSHA, and that's what we're focusing our attention on. And we just we find that that's enough to take up all of our time and not to have to worry about these things, because it's not going to affect us. We're going to continue to do what we've always done.
Well, thank you for that. That's encouraging. We hope you hang tough and do your job, and we've got your back. We're going to stand strong for the IGs however we can. I yield back to you, Mr. Chairman.
Thank you.
Thank you, Mr. Raskin. Next, we recognize Ms. Porter. Ms. Porter, you are now unmuted.
Hello, Mr. Dahl. I wanted to ask you about your recent report, which I believe came out this morning, the semi-annual report from the Department of Labor to Congress. In it, you mention the need for additional data to do appropriate oversight. And specifically, you talk about access to something that I believe is called the National Directory of New Hires, which can be used to help conduct oversight of unemployment insurance and disaster unemployment assistance. I wondered if you could elaborate to the committee on what the barriers are to the department to your office having access to that data, and why it would be useful to the American people.
I'd be happy to answer that. That's a very good question. It's something that we've been pressing for several years, because it's such a helpful data set in all of our work. Actually, GAO has access to it, and so do the states. But federal agencies like the Department of Labor, we don't. And let me let Elliot Lewis tell you how it could help our work very specifically.
Okay, I'm sorry. I lost a little bit of the volume during the question.
I'm happy to repeat
I can answer the question, Congresswoman Porter. Thank you. Getting the directory of new hires would allow us to determine if how quickly people are coming on board and being hired, and if they are if they've already been hired again and employed, they don't need to be getting unemployment payments. And so those are some of the things that we would be determining if there's a sort of a gap or a lapse in that time to allow people to getting payments when they're not entitled to them any longer. And that could also help us on the investigative side as well. And there's other data sets, and actually Congressman Raskin referred to them, that the states have, that would be state employment data that we could use.
That's very helpful to know about, and I am interested in assisting you in getting this data, particularly because I think with the pandemic type of unemployment, which is often unexpected rather than sort of cyclical, and we see businesses opening and then having to step back in a very uncertain labor market environment, I think we are more likely to see people being laid off and then being rehired, hopefully within a very short period. So I think it does make the administration of this difficult. I also wanted to ask you about the recent OMB guidance about CARES compliance. As I understand it, OMB's direction is that agencies and recipients will not have to report the number of jobs saved. I wondered if you could share any thoughts on that OMB guidance.
We've looked at this not only in my office, but also the Pandemic Response Accountability Committee, which is a committee of IGs. And we're looking at that, and we have some concerns about the data that's being required from agencies.
Great. And then last, I just wanted to ask you, do you feel that there is, you guys are a leading statutory member of the Pandemic Response Accountability Committee, and I wondered if you could opine about what specific oversight activities your office will be leading specifically within that.
What we're doing, let me give you an example. We just led last week a UI training session for not only the PRAC members, but also our law enforcement partners, so that they could understand not only the connection points with UI fraud, but also the fraudsters are targeting not only the UI program, but other benefits programs as well, Social Security, tax, and others. And so the better that we're coordinated in going after these fraudsters, the more successful we're going to be. And so that's one of the reasons that we're doing this kind of training and outreach to making sure that we're coordinated and exploring collaborative opportunities.
Excellent. Thank you so much. I yield back.
Thank you very much, Congresswoman Porter. And thank you for joining us. I know it's early your time, so thank you. I think I'm next, Elisa.
That's correct.
Thank you again, Mr. Dahl, and your team for being with us. Let me begin by asking, you cited in your opening statement that given the size of the CARES Act pot for unemployment insurance, especially, you were looking at based on previous experience of a number of, say, up to $26 billion in improper payments, including fraud. Could you just describe, how did you arrive at that number? What was that just a guess? Was there some methodology you applied to the base?
It's actually it's a low estimate, Mr. Chairman. That estimate of 10% comes from the department. ETA has estimated almost every year that the improper payment rate for UI hovers around 10%. And so, but they acknowledge that, under the CARES Act, with so much money, the improper payment rate is going to be potentially much higher than that. And so that's where we came up with the $26 billion at least that we will be looking at for improper payments. And the fraud rate within that, could range from 3 to, much higher percent of that improper payment, which would be attributable to fraud.
Are you coordinating with the U.S. Attorney's offices around the country on that aspect of the UI problem?
Yes, we are. In fact, Mike McCulkin can tell you, we produced a heat map, which we're happy to share with the chairman, that we've given to all of the U.S. Attorney's offices And we provided it in the training that we had last week, which included U.S. attorneys' offices and DOJ on there, to show them in their district, in their states, how much fraud would be found in their district, so that we can give them sort of a target number and illustrate and highlight how important it is for them to attack this.
Before I call on Mr. McCulca, let me just say, I think this is a very important aspect of your work. Getting U.S. attorneys to make this a priority is very important. Each U.S. attorney, and there are 99 of them, have a lot of discretion in what they decide to prioritize. For example, a big part of improper payments every year is Medicare fraud. But getting U.S. attorneys to make that a priority, very hard to do. When one did in Boston, that 1 year they recovered $3 billion. Multiply that times almost 100, there's a lot of savings to be had, but you got to move it up on your priority list. So especially right now, if we can do fraud avoidance with your work and getting the attention of the U.S. attorneys, I think that's going to be critical. Mr. McCulca, Mr. Dahl referred to you.
Thank you. Yeah, like IG Dahl said, we are seeing a significant amount of fraud. It's unprecedented in our history. We are tracking it with a heat map so that we can let our partners at the U.S. attorneys know what we're seeing in their particular districts. I'm happy to report that so far we have received no feedback that we've gotten any resistance from the U.S. attorneys throughout the country. In fact, most of them have told us that they have made CARES Act related fraud and pandemic related fraud a priority for their offices, and their actions have shown us that.
Thank you. And if you can keep us posted, because Chairwoman Maloney knows our committee for years has made improper payments a real focus of something we can do something about. And it's at least about $150 billion a year. So it's, over a 10-year period, it'd be a nice little down payment on the debt. It's money we don't need to be wasting. Not all of it's fraud. Some of it's just, technology systems, mistakes, duplications, redundancies. Non-qualified people being called qualified by accident, but getting systems in place to track this and try to prevent it in the first place is a lot easier than trying to recover it after the fact. So we're very pleased to know you've made that a priority and you've jumped that gun properly with the U.S. attorneys, and we certainly want to be supportive and helpful in that effort. In response to Mr. Raskin's question about OSHA, Mr. Lewis said that he was only aware of one violation citation during the pandemic, and that he added that one reason maybe for that is that it takes months to process such a citation. Given the fact that lives are at stake, people are dying in meat packing plants all around the United States, that on multiple occasions they've had to close because of rampant contagion. I mean, hundreds of workers being tested positive and being very sick. In fact, in most cases, if you've got a meat packing plant, you've got a hotspot wherever you are. The largest single number of cases, for example, in the state of South Dakota, meatpacking plant. Eastern Shore of Virginia, meatpacking plant. Likewise, Maryland, and so we know there's a real problem. And I guess I don't think we ought to be settling for the fact that, well, OSHA has its way and it takes months, and meanwhile, people could be dying. So let me ask you this, Mr. Dahl, are you satisfied with the pace of OSHA's inspections and certifications? And are there things your office can do to help them expedite the process in order to save lives?
I was very surprised that only one citation had been issued to a nursing home, and I don't think it took months. I think it was recently issued after the OSHA was informed of it on May 5th. But we are evaluating this important dynamic, and as Elliot Lewis said, this is something that we're planning on turning our attention to look at their enforcement activities and seeing if they are following their standards and what can be done to make them more efficient and effective?
Yeah, I guess I would ask personally, if you can move that up and expedite that, we have a chance of saving some lives at assisted care facilities, nursing homes, and of course, meat packing plants, which are vital for the food supply in America, but not at the expense of the men and women who are working there, who often have no choice but to work there. They don't have the option of working from home. So I would hope we can try to make that a priority. You talked to Mr. Sarbanes. He asked the question I was going to ask about unemployment, because while we can set rules, and we did, we expanded the payment, we expanded eligibility, we expanded the time frame, we waived rules about normal work requirements and waiting periods. We did all that. So we changed the rules. The problem is every unemployment program is run at the state level. The federal government doesn't run unemployment. We set rules and parameters, but states run unemployment. And every state has its own system and permutations in the rules, but also every state has an IT system that in many cases is simply not capable of handling the volume or programming the changes to absorb what we did in the CARES Act on unemployment insurance. To what extent are you going to be looking at very antiquated legacy IT systems, many of which still use COBOL, that need to be upgraded and reinvested in if we're going to make, if we're going to pump this injection of cash into the economy that it so desperately needs?
The difficulty, you're absolutely right. These legacy IT systems were an issue and a big concern for us for the Recovery Act. And there were some improvements made, but the difficulty is that during a pandemic is not the optimal time to be upgrading IT systems. No. And so, Elliot, can you address? Are we planning on looking at that, and what's going to be our focus?
Absolutely, that's definitely something we are looking at, and I think one of the focuses will be because, as the IG said, we've noted this in the past. We've seen that was allocated, that could have been used to upgrade systems that, at least at the time we looked at it, wasn't being spent or spent for that. We'll definitely be looking this time what could be done different so that the shortcomings in the systems are addressed now or in the near future, so that the next emergency that we have, disaster situation, whatever the case may be, that the systems are better prepared. Because although there were lots of changes to the program this time, they still fall in general categories. The $600 increase during the Recovery Act, we had a $25 weekly increase. So amounts are different, but systems should be adaptable enough and learn from the experiences of how these things were implemented in past cycles.
So I know they should be, but I'll take my own home state of Virginia. So for people who previously were not eligible by definition for any unemployment insurance, sole proprietors, gig workers and the like, they have to apply into the system and get rejected. And then once they get the formal rejection, they then go to a different window with that rejection and ask for reconsideration under their new status. So it's like a 2 or 3 step process for them. And of course, not everyone in that category understands that's what they're supposed to do. They think rejection is rejection, right? So it just seems to, well, and of course, we've had the problem with IT at the federal level with the CARES Act too. E-Trans system at SBA has crashed multiple times. The IRS having difficulty getting checks into everyone's hand who's supposed to get it. And of course, at the state level and even at the local level, school boards and so forth trying to do remote learning with technologies that are not always working. So looking at one of the things I commend to you is, and our subcommittee has jurisdiction over this, but the role of IT in hampering the mission or in obviously expediting it or integrating it so that it's effective. I think is really critical. Two more questions. Mr. Dahl, we wrote the Secretary of Labor, Mr. Scalia, about his and the president's interference in the independent decisions of the Federal Retirement Thrift Investment Board. It's my understanding under the law, the board is vested with the authority to make investment decisions and nobody else. Is that your understanding?
I'm not clear about how the Thrift Investment Board operates. It is an independent agency that we don't have authority over, but and so I'm not sure exactly how that works at the Thrift Investment Board.
But the angle here is the secretary of your agency chose to interfere with the actions of an independent board, and thus, presumably, by that action on his part, it falls within your purview of scrutiny. Not the board per se, but the actions of the Secretary of Labor.
Right. Now, absolutely, we have the authority to investigate any misconduct allegations involving the secretary. We absolutely do have that authority.
Okay. I just commend it to you. We'll be glad to provide you with a letter and ask you to review it.
Okay, that's thank you. Appreciate that.
And my final question has to do with SIGI, your role in SIGI. You chaired the IG Independent Committee that is supposed to self-police. It provides presumably accountability and transparency. And you have stepped down from that role. Is that because of normal rotation, or was there some issue that prompted you to make that decision?
I've been on it for a long time, and I think there are dynasty rules that apply to my tenure.
Well, as you know, I have a bill on SIGI to enhance accountability and transparency and to beef it up so that it has more enforcement teeth. Because my view is that you need to be as pure as driven snow, so that you are beyond impeachment in terms of your testimony, your credibility. If you've got flaws, if you're seen as being involved in deliberate partisan gamesmanship, it's going to taint your the findings of your reviews and significantly lessen your credibility. And the problem is, one bad apple can take the whole thing. And so we want to beef up the role of SIGI, and we'll be very interested now that you've stepped down and getting your input and your review, your opinions about that as we try to move forward. And I would welcome that.
And we'd be glad to do that. I'm happy to discuss this with you further. As you know, this is also accountability is an issue that's near and dear to my heart as well. So I look forward to it.
Super. All right. Are there any other members wishing to ask additional questions or make any comments? Mr. Dahl, do you have any final comments you wish to make?
No,
not final for this hour.
Thank you. No, I am encouraged by the sun behind you, and so I do look forward to that as well. So thank you for bringing that to the briefing today.
Thank you.
Mr. Chairman, can you hear me?
Yes, Mr. Raskin.
Well, if I could just follow up on the line of questioning I had that you developed too. Can one of our guests explain, Mr. Lewis, Mr. Dahl, explain why it's so difficult to issue a citation when there's a clear violation going on? Why is that a process that takes months? Is that something that they've investigated? I mean, when they give my car a parking ticket, they do it right there on the spot. Like, well, what's the difficulty here?
Well, I don't know it. I don't know that it's, they do all take that amount of time, but the time is allowed before a citation is finalized. So I would have to look at them case by case to see if there was, good reason for what took so long to deliberate the citation.
Gotcha. Okay. Thank you, Mr. Chairman.
Mr. Chairman?
Ms. Maloney, yes. You need to-
I heard you correctly. I've got to unmute, right? Let me see if I can.
You're unmuted now.
I'm unmuted? Okay, thank you. Thank you just so much for this hearing, Chairman Connolly. And IG Dahl, you mentioned that the OSHA had only issued one citation against a nursing home. In New York, we lead the country in deaths, and over half of them, well over half, have been in nursing homes. So this is an area we really have to focus on why this is happening. And what, can you tell me, does OSHA, was this a federal OSHA citation or a state OSHA citation? And who has the authority to put the rules in place to monitor the effectiveness of saving lives in the nursing homes? And your ideas of how we can do a better job in making sure our nursing homes are doing the right things to take care of their people. Obviously, something's wrong when over half of the deaths in New York City and possibly other places are coming in our nursing homes.
Thank you, Madam Chairwoman. I share your concern, and my understanding is that citation to the Georgia nursing home was from OSHA, from a federal citation, and I don't know exactly what the state's role could be involving nursing homes. I know that HHS has some oversight as well in terms of the safety of nursing homes. And Elliot Lewis, did you have anything to add to the chairwoman's question?
Yes, and yes, my understanding, the one citation I was federal citation. And yes, a lot of states are covered by their state OSHA plans, but the federal government does have some oversight responsibilities over the state plans as well as the federal states.
Could you give us some ideas of how to improve this? You know, obviously there's something wrong when over half of the deaths are in the nursing homes and well over half. On how this should be implemented. What exactly is the federal role and what exactly is the state role? You know, if the federal role has the authority to go in and see what's going on, they should be more active in this area during this pandemic.
Yes, and that's exactly what we are looking at, will be looking at. I don't have the answer to that yet, but we're definitely looking at, we'll be looking at specific industries, such as, or businesses such as nursing homes or the meat processing plants, to look at what's occurring in those plants in terms of people being injured, ill, what could have been done, what should have been done, what oversight took place, what inspections took place, what enforcement took place.
Well, we've got a lot of work to do.
Definitely.
Just say, Mr. Lewis, if I may add on to what Chairwoman Maloney is getting at, I hope that we don't just look at this retrospectively. The virus is still with us. It is still spreading. Nursing homes continue to remain very, very vulnerable. Anything we can do to expedite OSHA's reviews so that we can take preventive measures to save lives, both at meat packing plants and at congregate nursing homes and assisted care facilities, will actually save lives now. And so I would hope that we would put this on the front burner as a priority.
Absolutely, we are. And that's why we've divided our work into the phases. The things that we can do the quickest of looking at that guidance and what went out, what were the challenges, how are they addressing them, et cetera. That's what we're going to be reporting out on first. The retrospective work, as you said, that takes longer. So we've scheduled that to be done at a later phase.
Yeah. One of the things we asked Mr. Horowitz in setting up the PRAC is to do flash reports. So we're getting reports from IGs in real time. They're not the normal comprehensive reports. They're not retrospective reports, but they allow us to try to intervene and take corrective measures to prevent something bad from happening. I assume, Mr. Dahl, Mr. Lewis, you are in fact participating in that process from DOL.
Yes, we are. And we call them alert reports. We've already issued one on unemployment.
Thank you. Sorry, back to you, Chairwoman Maloney.
I think we should ask for one of these plans, correctly pointed out, on nursing homes. It continues to be the hottest death spot in our nation, and there's something very wrong there. And we need guidance on what we can do to help. And also the meat packing. And I think also we need to get exactly what are the criteria to close down when we have a problem. You know, what is the national criteria for a meat plant, for a postal sorting plant, for a GM, for all these places that have been closed down temporarily, to look at what are those criteria and for opening back up quickly. Anyway, there's a lot to do and a lot of challenges. Thank you for this hearing and for the sunshine you brought with your beautiful sunshine in the background. Thank you. I yield back.
Madam Chairwoman, and I believe Katie Porter has an additional question or two.
Thank you. Mr. Dahl, I wanted to follow up on something else that you mentioned in your semi-annual report regarding the Federal Employees Compensation Act. So as I understand it, this is in essence workers' compensation for our federal employees. And one of the things that you mentioned was some opportunities for Congress to ensure that the federal government isn't overpaying with regard to pharmaceutical prices, and also some challenges that you pointed to with regard to when a fraudulent billing practice is identified, and we know that there's a fraudulent billing going on, how difficult it is to shut that down.
Those are, I'm first of all, I'm really happy and gratified that you're reading our semi-annual reports and that we have
I should tell the public, you can get them on Twitter. You can sign up to follow the Office of Inspectors General on Twitter, and you too can get all of these wonderful Inspector General reports the moment that they're issued from across the federal government. And so I just want to tell everybody, if you need some pandemic reading, I commend the amazing work of our Inspector Generals to the American public. Thank you. Go ahead.
Well, thank you. I will get more followers now thanks to your pitch, and so I appreciate that. I'm going to let Elliot Lewis answer your question on the prescription drug pricing, because that's something that we've been looking at several times over the years. But on the overpayments, this is an area that it's just really it's affected our ability to do these fraud investigations when the Department of Labor, allows some of these payments to go out, and so we've made a lot of progress with the department and with the PICA program and the OWCP, which administers the program, in their procurement office, and trying to identify those drugs that are causing a lot of the fraud to occur. And so on the prescription side, Ellie, did you want to answer Congresswoman Porter's question?
Sure. As the IG said, that's something that we've noted for a number of years now in PICA, and a little different than when we usually make legislative recommendations. This one, we believe that's one option for solving this issue. It's not the only option. There is a federal drug price law that's used by some other programs, and we have suggested to the department that they look at that as one possibility, but they can certainly do it on their own in terms of developing pricing schedules and how they're going to pay better prices. We are launching yet another review looking specifically at managing the pharmaceuticals and the pricing, and comparing it to what other programs and state workers' comp programs are paying and incurring for the same types of services, pharmaceuticals that we're doing in FICA.
Thank you very much, Mr. Lewis. And, my understanding is that annually there's about $900 million paid out for medical costs through the Federal Employees Compensation Act. So I think it's really important that the federal government be modeling how to manage pharmaceutical costs and pay a fair price, and modeling that for our private insurers and for our state unemployment disability program, federal workers' compensation programs. And also, I think that this issue of fraudulent billing, it's to me just flat out wrong that we would know that there's fraudulent billing going on and nonetheless allow payments to be processed when there is a better solution. So I'm going to ask my staff to continue to reach out to you to work on some legislative solutions to this. And I appreciate your proactive work in your report, really pointing the way to Congress on how we can be more effective. So thank you very much. I yield back.
Thank you, Congresswoman Porter, and obviously the subcommittee stands ready to work with you and your staff in formulating legislative solutions to the problems you've identified. And I think Mr. Dahl, Ms. Porter in many ways epitomizes members of our committee and subcommittee. If we're not reading GAO high-risk reports, we're reading at nighttime IG reports. It's just who we are as people. So at any rate, thank you so much for your diligence, Katie. This is a series of ongoing briefings and hearings we're having on IGs. Our committee is going to be very vigorous in protecting the independence of IGs and in making sure that they're allowed to do their jobs, especially given the incredible circumstances in which all of us are operating. But it is very important that when we pass over $3 trillion in federal relief with 57 spigots that we know of, you can ask yourself, what could go wrong there? And that's the question IGs ask, and those are the answers they need to seek. We obviously want to do everything we can to prevent bad things from happening while we know they could. So when we've identified a problem, as Ms. Porter was just indicating, we want to try to intervene right then and there in real time and stop it from proceeding. So we're not wasting taxpayer dollars that have to be recovered or written off subsequently. And so our subcommittee, our full committee certainly stand ready to work with you and your team, Mr. Dahl, in that endeavor. And with that, I want to thank everybody for joining this brief, and we'll meet again. Thank you very much, Mr. Dahl, Mr. Lewis, and Mr. McCulca for joining us today. This.